Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Well, good morning. Welcome back to Insurance Matchmaking. Flying solo again today. Just kind of want to cover some things. One of the things is, as this program airs, we have just passed two major deadlines or ends of enrollment periods, but what I want to kind of address here is it's not the end of the world if you miss that deadline. There are other opportunities that we may be able to still help you with your different health insurance needs. Of course, December 7th was the end of the Medicare annual election period, and you notice I did not say open enrollment. It gets very confusing. Medicare uses the term open enrollment for several different things, but that October 15th to December 7th is actually called the AEP, but it does get called, Medicare open enrollment a lot. But I'll address that also of why that's not the only thing that Medicare calls open enrollment. One of the things is when you're first brand new to Medicare, it's your what they call your initial election period, but you also have a 6-month open enrollment for a Medicare supplement, also referred to as a Medigap, because those plans that go alongside your Medicare, sometimes called, as I said, Medicare supplement, Medigap, sometimes called a secondary, they cover that 20% that Medicare doesn't cover as your co-insurance. So because they are supplemental to Medicare, they are not major health plans, so they can be underwritten, which means you do have to medically qualify for those plans. So the good news is when you're brand new to Medicare, most of the time when somebody first turns 65, you have that 6-month open enrollment where you can get a Medicare supplement and they don't ask you any health questions. Sometimes people will delay their Part B because they're on a group plan, so they still get that 6 months when they pick up Part B when they leave that group plan. But if they go ahead and get their Part B when they're on when they turn 65, but they stay on their group plan, when you leave that group plan, you do not have that 6-month open enrollment. You do have a guaranteed issue period, and that's what gets a little confusing on those, is the difference between open enrollment and guaranteed acceptance and guaranteed issue. It's one of those things I could tell people, it's a matter of definitions. That's why, a Medicare Advantage is not a Medicare supplement, but a lot of people will call their Medicare Advantage plan their Medicare supplement. In their mind, it is supplementing their Medicare, but the definitions and the way CMS classifies those, it is not accurate. So anyway, that's one of the open enrollments. The other one is on the Medicare Advantage side, it's only if you already have a Medicare Advantage. You have what's called the Medicare Advantage open enrollment, and that is from January 1st to March 31st. So anytime in that 3 months, you can take a one-time, I tell people, you get a do-over, but it's only a one-time during that 3-month period. And it usually comes into play when you signed up, or maybe you've even had your plan for several years and your doctor was in network, and all of a sudden you go in, say in February for appointment, and you hand your card to the person at the counter, for them to set up your copay, and they go, "Oh, we don't take that anymore." Now you're going to be paying out of pocket. Most likely you're going to reschedule your doctor's appointment so you can come back, but you can get a plan and have it go into effect that next month, and then you've used that option and it's done for that 3 months. Now you're waiting again for the next year for the annual election period. That works great if you have a Medicare Advantage plan. A few years ago, we had what they called the Medicare Advantage disenrollment period, and it was very confusing because that was MADP, which is very confusing to we call a Medicare Advantage that includes your drug coverage, and MAPD. So a lot of times it confused us too. So anyway, during that time with that disenrollment period, you had a month and a half. It only went to February 15th, but it only gave you the option of, hey, I want to pick a drug plan and go back to having a Medicare supplement. You could do that. You can still do that. You can still do that during the Medicare Advantage open enrollment period, or you can switch to another Medicare Advantage. With the old disenrollment period, you couldn't switch to another Medicare Advantage. You could only disenroll. So this 3-month period really helps a lot more people than that old disenrollment period did. But if you don't already have a Medicare Advantage, that plan's not going to help you, that period. If you forgot to check your drug coverage on your Part D because you're on a Medigap plan G or F or N and you have a separate drug plan, that had to be done before December 7th. Unless some people will qualify for some other special enrollments, and there are sometimes ones that will pop up during the year. There'll probably something that'll come out of the tornado that we just had in Middle Tennessee and Clarksville and around the Nashville area. That will probably stimulate a special enrollment. But when you have those disasters, it's if you didn't take advantage of that enrollment period, if you were in an enrollment period during that time, it extends you to be able to do another choice. The downside on that for most people with Medicare was after December 7th, so it's not going to affect that you missed doing something during the annual election period. But then again, you never know what might pop up for that. That's kind of the stuff on the Medicare side. The other deadline is more recent, and that is December 15th was the deadline for the ACA, also known as Obamacare or marketplace plans, to change your plan or pick a plan to go in effect on January 1st. Now, I say it's not the end of the world. If you already have a plan, generally the marketplace will automatically re-enroll you into another plan. So sometimes you need to update. Maybe you didn't update your income. Maybe your income's gone down and you should get a little bit better tax credit, or your income went up and you realize you need to get a little bit less tax credit to help pay for that insurance so that when you do file your income tax in the following year, you don't get hit with a big chunk of money you owe on your income tax because you got more subsidy on your health insurance. So we do have the open enrollment actually goes until January 15th, but anything from now to January 15th, if you pick a new plan, it won't take effect until February 1st. So if you missed the open enrollment, or you just to sign up, or you didn't change your plan, the good news is you're more than likely still going to have the plan you had this last year, or this year, I should say. And you can still change your plan for February 1st. So the biggest thing that's going to affect is maybe you need to postpone a doctor's appointment until February because the doctor you want to see doesn't take the plan that you have right now. Or, and also some people, what they'll do is if they're going to change plans, they may not pay that premium for January. So the company will cancel you for non-payment. Now, the downside on that, the risk on that is if you lose your insurance for non-payment, that does not give you a special enrollment to pick another plan. So if you're thinking of, well, your premium went way too high and you can't afford that and you want to switch to a plan with a lower premium, you will have to change insurance companies because even if you go to a plan that's a lower premium for February, they're still going to make you pay for whatever plan you had for January if it's the same company. So I'm not telling people don't pay your bills, but there is kind of some light at the end of the tunnel of you can not get stuck with a big bill because you didn't update when you were supposed to. So, and again, also, if you're in good health, there are a lot of alternatives to the healthcare marketplace. And the other thing is on the healthcare marketplace, a lot of people have avoided it because they had a little bit higher income, and maybe a couple of years ago they checked and they weren't eligible for any subsidy at all. Well, with the Inflation Reduction Act, that was changed from 400% cap of the poverty level being eligible for a tax credit to a figure that you should not have to pay more than 8.5 or 8.8% of your income on your health insurance. So that means people who are a little bit higher income are now qualifying for a tax credit. And it may not be a huge tax credit, but it still helps cover that, especially if you're running into issues of not having you can't go to an alternative. I have a client that had one of those alternative plans. Unfortunately, the mother or the wife developed breast cancer this last year. So the plan she had, it was they have to cover you once you're on it, but they're at the end of their term on that plan, and to renew it, she can't renew on that plan because of her, pre-existing cancer history now. So she's had to look at marketplace plans. The other thing is, just recently we did a quote for a couple, and their income they estimated at $200,000 for just the two of them, and no kids. They still qualified for a tax credit. It's not going to be a big, huge tax credit, but they weren't. They weren't going to be stuck with having to pay full price either. And the reason I bring that up is, in the past for a couple, it was kind of around $65,000, 65 to 69 as the years. Each year went up a little bit more because the cost of living adjustments go up. But most of the couples I had, if they were between 65 and 69,000 adjusted gross income, they weren't going to qualify for a subsidy, and that's what caught some people short when they did their taxes and realized that they went over, and some of them were getting like a $1,500 a month tax credit that was helping them. And they were paying about $200 then for their insurance, which wasn't terrible. But when they filed their income tax, that amount they were over the minimum. And it's like I tell people, it's like a cliff. As your income goes up, the tax subsidy starts going down. But the problem was when it was that 400% level, it just dropped, it just went away, and it hadn't tapered down to zero. So now a lot of people are seeing that with a higher income, they still qualify for a tax subsidy. So, and if that's your situation and you've held off from doing an ACA plan because you figure, well, you're not going to get a tax subsidy, so it's still going to be way too expensive, so I'll just take my chances, maybe go to the health department or hope nothing drastic happens. Give us a call. That's one of the things that we can help with. And as I've mentioned a couple times on the show, is there are 3 of us in the office licensed. Kalia was on my last show with me, and she started working her first client yesterday. So if you're needing help with health insurance, you call. Whoever answers the phone in our office is going to be able to help you. So we're kind of coming up on the commercial break here. So I'll pause, and then we'll get back into what's some of the things that we can do to help you.
Before Santa arrives, make room in your home by donating your excess items to Habitat Restore. Simply drop off your donations at 560 South Jefferson Avenue in Cookeville. Check off the rest of that Christmas list when you shop at Habitat Restore. Find great deals on home decor, furniture, appliances. Now open Tuesday through Saturday with extended hours until 6 p.m. Let Habitat Restore help simplify your holiday season.
This is Emily Gibson, your Twin Lakes security consultant. The holiday delivery season is here. Know what's happening with Santa or the services that don't use reindeer with a high-definition camera system from Twin Lakes Security. With Twin Lakes, you can monitor deliveries in real time to ensure your packages are safe and secure. Give me a call to talk about protecting your holiday deliveries and more at 931-528-2005 or visit us online at twinlakes.net.
Twin Lakes Security, TN-CERT C-0026.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, welcome back to Insurance Matchmaking. I was talking about missing deadlines, and anybody in the office can help you now. So, like I said, anybody answers the phone in our office right now is a licensed agent. If you listen to this later on YouTube or something like that, a couple months later, we may have somebody else that's just answering the phone. But as the original airing of this episode, everybody in our office is licensed. So one of the things, we've gotten a little bit of pushback from people calling in. We do have some procedures that we ask everyone to help with and help us be able to best help you. And especially when we're working on things, but hey, the phone rings. If we're not speaking right then with a client, we're going to answer the phone, but we may not have time to go into everything to figure out your and get you a quick quote. They're not that quick, but we can get them to you in a timely manner. But there's 2 things that we ask you to do when you call in and ask about that is we're going to send you 2 links to, and it's called Jot Form. That's the program we use where you can fill out the information online, and then it puts that into a PDF form for us. So we have we can have a paper record or electronic record of that transaction. If you are looking at ACA health plans, CMS started back in June. They started a program now that we need to have proof of consent from you to work on your behalf on your ACA health plan. So we ask you to sign that form, and it's real quick and easy. It's just a matter of, like you type your name in the box, another one, and you can let it put your signature in, or you can do it's like a DocuSign that you can draw, with your finger or with the mouse, however you want to put it, and then type in to print your information. And that's just so we have that written proof that, yes, you did indeed ask us to help you. There's been a lot of unscrupulous folks out there getting somebody on the phone, find out what state they live in, and get their birthday, and they go and update your health record, and they may not change your plan, but they just went through everything, but they put their name on it as the agent, and then it cuts out whoever your agent was that signed you up. There are some protections kind of coming in place from some of the carriers. Are going to tightening up a little bit on that, but it was real easy for these people because you'd call and answer an ad, and of course they're going to check to see if you can get the savings, and the next thing you know, you've either changed your plan. We've actually had a couple people that say they were enrolled in a plan and they never asked to be enrolled in a plan. So unfortunately, there's people out there that aren't working honestly. We're not going to put you in a plan unless we get your approval on it, but we still have to have that form signed. The other one, and this on the Medicare side, we have to have what's called a scope of appointment, and that form, that permission has a 48-hour rule in it that if you want me to give you quotes and present a Medicare Advantage or a drug plan option to you, I have to have that signed 48 hours in advance. Now, the good news is if you're planning on coming to my office to go over those things, you can sign the form there at that time. And because you were a walk into my office, I didn't drag you in. I didn't corner you anywhere. You came to my office, so it's implied that you know what you're doing. You came to get help from me. I've heard some people talk about, well, if they called in to you, that you can count that as a walk-in. That's a gray area that I'm not really ready to step into yet. But if you come to my office, we can help you there, and you can sign the form at that time. But if you're wanting information over the phone or you want to set up a Zoom, we really do need to get that 48 hours in advance so that we are compliant with CMS. I don't want to lose my license and my ability to help people figure out their Medicare needs. And then the other link is going to be for what we call a client information sheet. We've got a couple versions of that. The one for the ACA is going to ask a little bit more information about your household and your household income, because that's very critical to what you might qualify for tax credit-wise. The other thing is, a lot of times they'll say, people want to say, well, I'm single. Well, you're single, but you have 2 kids. You have a family. And even if those kids are being covered by a parent for insurance or they're on Medicaid or CHIP, we still need to know who's in the household, and it is very important. We haven't put that on the form, but there's always, there's a box for more comments or, just notes that you can add that will help us figure out to help you is if you have, if your child has 2 households that, you have an ex and they spend 50% of the time with you and 50% of the time with them, or sometimes, and I did this with my daughter, was we traded off years, which year we were claiming them on taxes. We need to know that if you only get to claim your child, every other year on taxes, we need to know which year that you're claiming them on taxes, because it decreases your household size in computing that tax credit. Because the way it works is it's your household, whether they're getting insurance or not. The other thing is, if you are married, you cannot file separately. You have to change and file jointly with your spouse. And I know some people do that because of the way their careers are. One works self-employed, the other one has an employer. So a lot of times they'll do separate tax filings because they felt that works out better for them. Unfortunately, if you are going to ask for the subsidy through the ACA marketplace, then you have to file your form jointly. So that's the information we need on that. And then we also have the form for our Medicare clients, and we also have one that's for maybe they're an existing client. We ask for an update on their drug list. And also update on, if you've changed doctors, if you have a Medicare Advantage, we need to know if we're going to be looking at, if you're considering changing your Medicare Advantage plan for the next year, or just want to know, does it make sense to keep what you have? We need to know, if you've added any doctors, and to make sure that they're still in the network with what you have. And then your drug coverage. The drug coverage, whether it's on a Medicare Advantage or the Medicare separate, what we call standalone Part D, we need to know what your current prescriptions are, because just because your plan covers that prescription this year doesn't mean they will next year, or they may change what tier it's on. As those tier numbers go up, so does the price for that prescription. So it really helps us if you'll go ahead and send us that information. Preferably send us that information in September. because October 1st, we can go and compare all the plans for the following year. And it's really nice to be able to make those checks in September. It's not hectic. And we turn around and go, okay, I think let's set an appointment to go over your stuff. I think it might make sense to change your plan for next year. Or we can say, hey, everything looks great. If you're happy with your plan, we'll talk to you again next year. Because it gets very busy, and the way we build our business is getting new clients. Now, we're still going to take care of our existing clients. We're still going to get paid if if you switch from one plan to the other, but that's not new income. So it's very imperative of us to keep growing our business, to get new clients. And of course, there's always going to be those procrastinators that wait to a day or two, or the day of the deadline to get their help. So if we can knock out most of our clients' evaluations in the early periods of the enrollment period, it helps us a lot. And so like I said, if you can get that information to us in September, first part of October, it's very useful. And then I mentioned earlier, the enrollment period is October 15th to December 7th, but October 1st, we can go ahead and do the comparisons, and we can knock out, and we can call you up and just, or send you an email, say, we looked at everything. If you're happy, keep what you got. The other is the ACA information. You can send us that information in September or October if updating the income. We really can't do much until November 1st on the ACA plans. We do get, usually sometime during that last week of October, we'll get, an email tells, the marketplace is open for window shopping, as they call it. So you can go, you can go online and do it, or we can do it also, is just checking it against now what your income is, and see, what the tax credit will be and what plans are available. We can kind of look at those the first, like I said, the last few days of October. But again, we can't do anything with it until November 1st. I usually end up being really busy the first week of November because we are doing Medicare, but I'm also doing the setting people, reevaluating their ACA plans, and also in my part studying it. Got a big surprise this year was United Healthcare came in the mix in the Upper Cumberland for the ACA. So, when I first moved to Cookeville, we had Blue Cross. That was it. And then Bright Health came in 2 years ago. That was a mess. They're not even in Tennessee anymore, and they shouldn't have expanded into the other counties in Tennessee. They had a very limited network around Nashville and Knoxville, and that's the way they should have kept it, but scared a lot of folks, so that when Ambetter came around, they're like, I don't want to do Ambetter. Scared a lot of doctors because we're still waiting to get paid from Bright Health. I don't know if I want to go with Ambetter. So there was some hesitance there, and Ambetter came in very competitive on the pricing against Blue Cross. So still, and I signed a lot of people to Ambetter. Some of them it didn't work out that well. There were issues getting some specialists, but most of the people that I enrolled in Ambetter last year stayed with Ambetter. The good news is this year, Ambetter and Blue Cross they're not necessarily a big difference in pricing, so it did work out well for some of the folks to go ahead and switch to a Blue Cross plan for 24 and not have to spend a lot more than they would previous year if they went Blue Cross. And then then United Healthcare now is also available. So that gives us 3 ACA plans. So it gives us that competition, but we also have to search a little harder to make sure whether your doctor's in network or not when you've got 3 different plans to look at. So we go over that. That's what we do in the office. You don't have to do it. And you can call your doctor. It helps sometimes if you call your doctor. The problem is, if you call and just ask your doctor, doctor's office, and say, do you take United Healthcare? Depending on who you talk to, that yes or no answer could be completely wrong. There are different networks. United Healthcare has a lot of different divisions. They do, employee health plans. They do Medicare Advantage plans. They do Medicare supplements, which don't have a network, by the way. And they also have a division called Golden Rule, which is those short-term plans that are underwritten. They do use a United Healthcare network. So that's not necessarily the same network as you have with your ACA health plan or with a group plan. So just asking them if they take United Healthcare is not going to necessarily get the right answer. So that's why that helps when you talk with us, that we can double check to make sure the network that you would be signing up for takes that. So the best thing to do if you're calling your doctor's office to check network, don't just ask the receptionist that checks you in for your appointments. Ask them if you can talk to the billing department. Sometimes that's outsourced, so you may not be able to connect with the billing, but they're going to know exactly, which network you're dealing with and to ask them which plan is going to be the plan that works for you. So those are some things. Like I said, we've got some deadlines, but we also have some second chances, and there's always special circumstances. If you just lost coverage, you just moved. If you move from one county to another, that usually, even with the ACA plans, will stimulate a special enrollment period. Or if you have a Medicare Advantage, sometimes because you update your information, say with Social Security, and they update your Medicare Advantage carrier, and then you get a letter from them saying, oh, you've moved out of our service area. You can no longer have this plan. Doesn't mean you can't have a plan from that company, but that plan is no longer available in the county that you live in. So that's one of those things that just kind of to make sure you're prepared, or, if you're going to move, if you move to another county, you move to another state, let us know. Let us know before you move if you know you're moving. I do have licenses in other states, so I've had some clients that moved to Kentucky, and I was able to go ahead and take care of them. In fact, I actually got licensed in Arkansas because and actually they weren't even clients yet. It was just friends of mine that said they were going to be moving and they were going to need to be getting insurance because they were moving to Arkansas. So I went ahead and got an Arkansas license. I could take care of them before they moved. And then as they graduated to Medicare, I was able to get their Medicare plans. So those are some ways we can help you. Like I said, those deadlines aren't the end of the world. So, check with us. We might still be able to help. And that's what we do, and that's what we want to do. We want to be able to help you. So don't forget, insurancematchmaking.com. Any comments on the show, any questions, go ahead and submit that on that submit a question block. It doesn't have to be a question. And again, as I've mentioned before, if you know somebody you think I should have on my program that maybe they've got a nonprofit that you'd like me to help promote, or they're a veterans organization that needs some plugs, I can help with that. So until next time, if I don't hear from you or you don't hear me before, have a Merry Christmas, Happy New Year. But we will still have weekly programs. Hopefully I'm going to have new programs. If I don't get a chance to record, we may play some replays, but haven't done any replays yet. So hopefully your family's doing well. And I just mentioned earlier about the tornadoes. Very thankful. My daughter lives like about half a mile from where that tornado destroyed the strip mall right there on that 41A in Clarksville. And we were watching on TV and realized that was going close to her. So we're very thankful that she's doing fine and the kids are fine. So until next time, see you on the radio.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.